Great to see everybody here today. Most of you I've met or have heard of, so if we haven't met, hello. My name is Sarah. So a couple of things that we're going to be talking about today, just to give you a little agenda. We're going to be talking about Pisgah Health Foundation's focus areas for funding, a little background on how the legacy foundations, as they're known, partners with the Dogwood Health Trust. That's usually really confusing for people because these are all new organizations. And then we'll look at the application specifics. I would imagine just about everybody in here has already looked at the application, so we'll breeze through that part. I'll just try to give you as many specifics as I can. I need to let you know up front that we can't consult on content right now, and if you write grants a lot, that's probably really frustrating for you. It's not intentional. It's that this foundation is new. It started February 1st, 2019, and since then, the fact that they've been even able to conduct all the research that they've conducted, develop the funding focus areas that they have, executed on developing a grant application that's accessible online is pretty amazing already. And what they want to do is really work with the communities that they're based in, and part of that is learning from nonprofits what your needs are, what your hopes are, and any innovations. So going back to the content, it's not meant to be frustrating, it's just so that we can learn because we're not experts, not yet. All right, so let's take a look at the little bit of the background. The motto of Dogwood Health Trust was created with the transaction, the sale of Mission Health System to HCA Healthcare, is improving the health and well-being of Western North Carolina. Very broad, right? Part of that background is based on the social determinants of health. How do the legacy foundations work with Dogwood Health Trust? So there are 6 of them, Pisgah Health Foundation being one of them. 4 of the 6 were former rural hospital foundations that were responsible for raising funds for the nonprofit hospitals that they served. They decided about 6 months before the sale was final, they had the opportunity to disperse all their funds and close house, or they could re-articulate themselves and become community health foundations and start investing in the communities that had supported the hospitals over the decades. So they decided to take a chance on that. Dogwood Health Trust was really impressed at their dedication to their communities and said, you know what, at the time of the sale, to support you as you get your operations underway for 3 years, we're going to give you $5 million a year that we want you to disperse in your own grant making. It was a really wonderful vote of confidence. But there are 2 things to this. First of all of these, the 6 legacy foundations are independent. They have independent boards, they have independent staff, they have independent grant-making decision policies. They're all different from each other. And that is really to reflect the rural place-based philanthropy that they're undertaking. So that's a really important distinction. Now, they have a partnership that you hope to have with Pisgah Health Foundation as a funder and a grantee applicant type of relationship. That's the relationship that the legacy foundations have with Dogwood Health Trust. So you have Dogwood Health Trust, part of Mission here. You have these foundations that are all individual, independent foundations. So if you want more specifically about each foundation, this is a really great story to check out. Support our local news and Smoky Mountain News. Part of the grants agreement, so when the Legacy Foundation said, yes, we are going to become grant makers and we are going to follow the Dogwood Health Trust framework in becoming grant makers. The Dogwood Health Trust said, well, we've had this research available since the 1990s. That's how long ago, early 1990s, that the research came out about social determinants of health. So if you're new to it, like our staff has been for the past couple of years, that's great. If you have a lot of experience, that's wonderful. We're going to need your expertise. Because even though the research came out in the 1990s that said there are these 5 areas that impact 80% of our health, right? 80% of our health is impacted by these 5 areas. 20% is impacted by clinical care. So even though Mission Health System, we have some wonderful other hospitals around the area, a lot of state recognition for our hospitals. We could have the best hospitals in the world. It would still only impact 20% of our health. And so they wanted to change that dynamic, particularly for our region, Western North Carolina is Appalachian, and we've suffered the same Appalachian impacts as our other Appalachian counterparts in other states have. A lot of resource extraction has happened to our 18 counties over the decades, and a lack of rural investment, which really impacts all the systems. So the legacy foundations, including Pisgah Health Foundation, said, we're going to learn about the social determinants of health. We're interested in funding that. So the areas of economic stability, education, social and community context, health and healthcare, and the neighborhood built environment sort of gave them a framework. Based on the CDC's research, they were able to start developing the research. Part of the research that they consulted were also the county health rankings. So each county in North Carolina commits to something called the Community Health Assessment, the CHA. See some head nods. Grant writers use this for research reference a lot. And when we were looking at these in February and March as we got going, there were a lot of counties that had just completed a community health assessment. One thing that we noticed are the county health rankings from the Robert Wood Johnson Foundation. So it's established for every single county in the United States, because we were curious to know how our region stacked up against the rest of the state. So the county health rankings, if you remember from last time, measure 5 things: the rate of people dying before the age of 75, the percent of people who report being in fair or poor health, number of days people report being in poor physical health, or number of days for poor mental health, and the rate of low birth weight infants. I'm going to pause here. This came up in a discussion yesterday. Someone said, well, how does this account for health disparities or inequities in our system? If you look at these broad categories, it includes those inequities, right? So we know that certain groups of people are more likely to die before age 75 than others for a number of reasons: lack of access to health care, lack of access to nutrition. So that is accounted for. Disparities in health inequities are accounted for in this. So here's where we stack up. So our region, right now, we're focused on Transylvania, Henderson, Buncombe, Haywood, and Madison counties. That's a pretty even spread. But if you look at some of the other counties on our impacts, well, and these county rankings have already come out for 2019. I'm just giving you some of the background of what the board and staff have been looking at to develop their strategies. Our counties actually count, if you add those up and get an average, the lowest third in the state. So even though we have some real bright spots, we have some growing counties, we have some growth estimates for all of the counties in Western North Carolina, it means we're still attracting people who want to live here. We have some situational infrastructure issues that hopefully with these assets we're going to be able to reset over time. But this is where we started. And all the wonderful people in this room are going to be the people who change this map, right? The foundation, Pisgah Health Foundation, is one spoke of the wheel. Dogwood Health Trust is one spoke of the wheel, but it's the people in this room and the people on your staffs who are going to make the changes in this map. So not to give you any marching orders, but I can't wait until I come to meet with you all next year, and we're going to look at how that's changed in 2020. So here's our region, again, Region C3. So I do want to pause a little bit. I get a lot of questions on what these are. So these regions are all split up into different geographic subsets, right? When the transaction was being studied by the Attorney General, they wanted to make sure that all of these counties had equal representation. So that's why in the West, you have Highlands Cashiers Health Foundation and the Nantahala Health Foundation in Franklin, and Pisgah Health Foundation in Brevard. Also, we have the W&C Bridge Foundation in Asheville serving Buncombe. E1, we have AMY Wellness Foundation, and E2, the Gateway Wellness Foundation. So those numbers just correspond to how the counties were tracked in the transaction. We probably won't use that going forward, but if you wondered about what that is, that is. So here we can see our population. So check this out. There are some really great things happening in these counties, right? Look at our 5-year growth estimate is 6%. That's pretty tremendous, especially for rural America. So congratulations, you have some great county and city managers. You have some amazing community colleges who have really tremendous workforce development programs who are all contributing to that. All right, so really what we're here to talk about today, the funding focus areas. All right, if you have a tablet or a laptop, also, if you want to go ahead and log into your application, because we're going to get to that, you feel free to do that. So we know that education is one of the social determinants, is a really critical necessity across your lifespan. It predicts how your employability, the likelihood of incarceration, and really a lot of facets of your life is determined by education. So the foundation has studied our counties, and they've looked at a lot of research, and these are the areas, the projects they want to consider for funding that will achieve outcomes to increase the long-term operation capacity of pre-K and through 12 social support organizations, to provide nursing, mental health, and career counselors in either nonprofit or education settings with special consideration given to bilingual programs. They also want to increase opportunities for early childhood education and improvement in high school graduation rates. Again, these are broad areas. I've looked at the list, so you have some real specific projects. You want to go back every time you can in your grant application, take it from your grant writing friend, and you want to reference these focus areas, okay? How you are going to achieve what? How you are going to increase opportunities for early childhood education and improvement and improve high school graduation rates, okay? So just a little trick. You want to get that funding focus area. If you are fortunate enough to cross a couple of domains, then you want to reference those, right? This is what we're going to do, and these are the areas of impacts, because you're going to be teaching the foundation how you're going to make the best use of their investment. All right, food security. Projects will be considered for funding to achieve outcomes really in two main areas. Increase capacity and provide healthy food to food insecure families and individuals. I get a lot of questions about specificity. Sarah, this is my project. These are the people we serve. And I will say, great. Again, that's a content question. So if you feel that your project fits in these funding focus areas, great. Apply. Let's have a look at it, okay? Special consideration will be given to organizations that seek to create new food sources in unserved and rural areas, okay? So if you have a project that you've wanted to try, if you have a home visiting program, say, and you want to bring people food boxes from Living Food Resources, and you have a way to do that, great, particularly if it's an unserved or rural area, right? That's where we need the concentration of these projects. In the housing and homelessness category, so economically unstable community members more likely to live in substandard housing and to be grappling with insufficient interior heating and cooling systems. I see some nods, so hopefully you folks work in housing and can speak to this specifically. Crowded conditions and the presence of toxic and even carcinogenic substances in the home like mold and asbestos. So they will consider projects for funding to achieve outcomes to address the lack of affordable housing for low-income families and individuals, especially relating to workforce development, again, supporting some other local initiatives we have. Special consideration will be given to organizations seeking to increase support staff at shelters. I want to pause here. So Pisgah Health Foundation, the other legacy foundations, and Dogwood Health Trust are big supporters of the Housing First model adopted by North Carolina. Unfortunately, in Western North Carolina, we have seen a rise in homelessness, particularly among families. And so when we held listening sessions, both with the Dogwood Health Trust and the Pisgah Health Foundation, this is feedback we were hearing about a lot from schools particularly. There's been an uptick in the rise of homeless families. So we do support that model. In reality, we know that we also need to support emergency shelters. So please talk to the staff if you haven't already, if you're going to be applying in this category. We're also interested in improving quality standards in housing for vulnerable populations. I love that. Again, it's broad. If you serve a specific demographic or group of people recently released from the hospital, for example, need some help, maybe their home is not handicap accessible. Whatever your project is that improves the quality of standards, really give us a description about the types of vulnerable people you serve as well. Help us learn. And also those that increase affordable housing models. They're also interested in piloting different affordable housing models, so please talk to the staff about that also. This category of really health access and health care, focus specifically on obesity, substance use, mental health, and health education. So health and healthcare includes diverse influences that shape your health. For example, health concerns in our area include obesity, which contributes to multiple chronic conditions, disabled residents, substance abuse, and also folks struggling with unaddressed mental health problems. So they've tried to create a very creative, innovative category that I've gotten a lot of questions about. So I'll try to be as specific as I can. They're also looking for projects that educate the community at large that mental health and substance abuse are real, true health issues within the community. So if you have any kind of outreach for your program, if you conduct any type of, if you are a domestic violence provider, for example, and you provide a certain type of outreach and you want to educate the community at large about any types of intersection of mental health issues that impact your client, that's a great avenue. That's a great opportunity. If you are a health provider, for example, and you provide school screenings and you want to, one of the things that you might want to, one of the tools you might want to provide your participants is a depression screening. All of those things are considered outreach where you're also educating the community about issues that happen or issues that patients are struggling with. They welcome projects specifically in that area. I love that. It's really creative. They're also looking for projects that create or expand substance abuse and mental health programs that improve mental health. This area is broad, and when we get to the evaluation section on the application, we understand that mental health treatment and substance use isn't really a one-shot deal, right? So somebody's going to go to rehab, they're going to come back, they're going to get a job, they're going to have housing and all these wonderful things. When that happens, it's wonderful, but not everyone follows a straight path. So we want you to articulate in the evaluation section what your project is doing that is improving mental health. You educate us. This isn't a gotcha journalism type of situation. We want you to educate us on the criteria that you are going to use with your patients to judge success, okay? Very broad, and again, they're not being prescriptive here. They want to learn from you in your mental health and substance use prevention programs what you're going to judge as an improvement, okay? So special consideration will be given to programs using telemedicine and to support ongoing staff training. That's really important to consider. Also projects to lower child and adult obesity rates through evidence-based programs. Again, if you want to try a program that you've seen work in other areas or you know that has a history of success, or maybe you've piloted something that if you had additional resources, you could expand or scale that. Just let us know what the evidence base supporting your method is, all right? And social cohesion. In the area of social cohesion, they are looking for projects to conduct outreach to low-income and minority children to improve social connectedness to the community at large. Again, very broad. Special consideration will be given to organizations seeking funding to provide scholarships for low-income and or minority children to attend summer camp programs. So we understand the planning for that really happens in the fall and winter for our region. We are also looking for projects that address community connectedness through existing programs. If you have a great mentorship type of program that you want to introduce into a new school, for example. Here are your staff contacts. We have Lex Green, he's the president of the Pisgah Health Foundation. Kathy Wood, whom you met earlier in the beautiful purple dress. She's the grant operations coordinator. You probably met with her, talked with her, received an email from her already. I can provide technical assistance, so that's really if you're having trouble with the grant application. Otherwise, Kathy and Lex will be happy to help you with all your application needs. All right, so here we are to the application. Ooh, it's so exciting. Some of this is going to be annoying to you if you write grants a lot, and so I won't be offended if you return other emails or eat another sandwich. But it's only to help you, okay? So organization name, obviously understandable. Your tax ID, I'm going to pause here. If you are applying for a school or a government agency, you do have a tax ID number. You just need to submit different paperwork other than if you don't have a 501c3 status tax certification or a 509A, we will accept a letter on letterhead stating what your entity is. So if you're a public school, Macon County Public Schools, we are governed by this Board of Education, and you can have the highest leader of the organization sign that, okay? Your legal name, mailing address, all pretty explainable. Year of incorporation. If you are unsure when this is, what that is, sometimes organizations have had the wonderful opportunity to be around for decades. You can look on the North Carolina Secretary of State website, and we'll give you exact year of incorporation for your charitable solicitation license. All right, so you can see at the heading here we have organization, right? So we start out, we try to simplify the application and organize it. So really in the first section, this is all these questions are related to the organization and the contacts of the organization. And there's a little bit of overlap on the request information for background on your organization, but really if you have questions about what the annual budget refers to, go ahead and check your heading. Oh, so they're asking for the annual budget for the organization, okay? Your background. So this is one of my favorite parts of an application. Please don't breeze through that. Your brief history of your organization. That's your birth story. If two people got together in a cafe and said, oh, we are going to solve this problem for homeless women and children, great, tell us about that. So those are some of the most beautiful stories that an applicant reviewer can read about your organization. And then, of course, the mission statement. There's a huge regional reset, and we do realize that. People are going through different strategic planning methods, mission statements are changing. If you have questions, don't let any of these questions be a barrier to you in your application, okay? If your organization is reconfiguring your mission statement right now, I want you to give us the mission statement that was accurate at the time of application, okay? That's fine. We understand. Lots of things happening. All right, organization primary contact. So that's the leader of the organization, and we do need their specific contact information. Don't shy away from that. And then the primary contact for the request. I would imagine a lot of people here today are going to be completing the application. So let us have your contact, and that really have that as valid, including the phone number, right? So if they hit something in their application that doesn't make sense or they have a question about, or maybe you explained it differently in person and they read your application, they were confused, they really want to have a phone number and an email for who can speak to the grant application. All right, again, don't let any of these questions be a barrier, okay? So the organization demographics, this is just to help us learn about your organization. We're looking for the paid number of full-time staff, the paid number of part-time staff, and you don't have to get crazy with FTEs. If you have 12 full-time people and 4 part-time people, that's great. Just let us know those round numbers, okay? Anything with a red asterisk is required to answer. So if you don't have volunteers or interns or other staff, you can just enter 0 for those. If you're not sure, because we understand that organizations shift a lot, maybe on this Wednesday you had 20 volunteers and next Wednesday you had 10. Again, at the time of application, we want you to give us your best estimate, all right, for those. Other staff, a lot of questions about that. Yes, jump in.
I assume that volunteers includes board of directors?
Yes, thank you. Great question. He asked, he was wondering if volunteers includes your board of directors. Yes, indeed, it sure does. You want to click on the icon to get your total down here at the bottom. Again, that's why you need to enter zeros. For your other staff and detail, if you have, for example, an organization in Macon County had the former HR director from a major airline advising their organization on HR policies. Wow, that's such a gift. So they considered them a vital but unpaid staff member. So this is a section. If you don't have any folks like that, maybe that don't advise or they're specifically on a committee, that's just what that refers to. And then, give us a little explanation of who the other staff are. Give us their qualifications, how they advise your organization. All right.
I have a quick question.
Yes, Caroline.
If you have sort of an ongoing consultant that you just pay a monthly fee or something?
Great. That's a wonderful place to have other staff. Carolina asked if you have a consultant that's sort of ongoing that you pay a fee to or you've contracted with any of your contracted staff that aren't part-time, that aren't regular part-time, you'd want to have in other staff. Thank you, Carolina. That's a great question. All right. So the purpose of the request, you want to summarize the purpose in 5 sentences. And this is very important. Remember when I said you want to look at those funding focus areas that we just talked about, those headings, even though they're broad, you want to focus back to how does your request align with the foundation's strategies, right? Because they're making investments in your request. They want to know how your project is aligning with what their strategies are, what they want to achieve. Of course, the grant amount requested. All right, we're going to pause here. Lots of questions always on the start date and the end date, which you'd think would be a really easy question in an application. So you can see how many folks are in this room. The board can consider multi-year requests. I would use that decision on your part judiciously, right? So they're new. They're going to want to make a lot of different investments. The higher your request is, even if it's a multi-year request that's dispersed over 3 years, it's going to be a riskier application. I mean, let's just get it down to brass tacks. It's open, and you can ask for that. You just want to make sure you've had a discussion with your staff and board on what the risk of that is, okay? So again, it's open. I would, recommend the funds will be dispersed by the end of the year. So if you need to give a calendar date, if that works better with your fiscal year, that's fine. This truly is open to what you think you can do with the funds that you're requesting, when that project would start and when that would end. All right, so Kathy has given an asterisk to the questions on this section that were part of your LOI. So you want to make sure if it's pre-populated that if you need to change anything, you're clear about what those changes are. Project goals and objectives. Please do not give 8 project goals and objectives. They are reasonable. They want you to be reasonable also, right? 5 is a lot, okay? Unless you're going to revamp a whole system and they're not necessarily making those investments yet. Make this reasonable and achievable, right? Because they want to invest in things that you all can feel like you can achieve. Now, if you do have 8 goals and objectives that are specifically related to the project, like we're going to pick up a child, we're going to educate them, provide the food, return them to home, and do follow-up with the school, that's great. Don't feel obligated. Again, you want to have what is reasonable and achievable in your grant applications. All right, your timetable. So the timetable that you're going to accomplish the stated goals and objectives that we just talked about. What timetable do you need? You can talk about quarters if that's how you can manage your project. You can give a monthly timetable. If it is buying a piece of equipment, you would have that obviously within a year to expend those funds. You can give us the timetable. Organization description. All right, you want to make a direct connection from what you currently do to what you want to accomplish. Okay, and this is where they want to see some of your research. Incorporate statistical facts if possible, right? So if you are a food provider, you're going to want to give some research into why your type of organization is important, right? Your current programs and activities. You want to give a description of these, and also please spend time to do this. Emphasize your major achievements of the past 2 years. The foundation staff is new and they want to learn about your organization, so take the time to educate them. If it took you a year to hire a fantastic executive director, great. They understand nonprofits. The human resources part of nonprofits is an important consideration. You don't have to have gotten a long leaf of pine award from the governor here. They just want to know if you finally served your 100th client and that's what you all celebrate in your organization, again, please describe what those major achievements of the past 2 years are. Take a little time. That's also fun to do with your staff. All right, so one thing on this application that is frequently confusing, we have 2 questions about relationships with other organizations. One is here. I've seen someone nodding, yes, because I know that collaboration question that comes up later. So the differences are, this is related to your organization. This is a little overlap. So you want a description of the formal and informal relationships that your organization has with others. Again, you're just helping us map assets, right? Who interacts with whom? We just need to learn about that. The collaboration question in a couple of beats. is related specifically to the project. If you are collaborating with other organizations on a project that you might be serving as the fiscal agent for, that's wonderful. We applaud your fiscal agency. But the collaboration question is specifically who is needed to collaborate to make this project successful. Okay? This is just to educate us, formal, informal relationships with the organizations. The collaboration question is specifically to your project. Go back. Because this came right from Kathy's RFP.
Okay.
Yes.
So if an organization gets funding from someone, would that be included under relationships or collaboration or both if it were for that specific program?
Oh, that's a great question, but it's actually under funding. So we have a question about list your funding sources if it's over $1,000. If it's not over $1,000, you can just have that in your narrative somewhere that this is.
But if their funder provides some oversight and assistance?
You could talk about that in relationships. That'd be fine.
Just a follow-up to that same question.
Yes.
So if the funding we're seeking from Pisgah is supplementing or supporting the program, but our major funder for the project that we're applying for, does that go in both places?
No, so you can talk about that in your program budget narrative. You can give more of a description of that. You'd want to talk about the funding and the staffing for the project in this narrative section, but on the budget narrative in the attachment, you can give more specifics to that. So if you know that the project costs $500,000, we have $300 from the state, we're coming to you for the balance of the $200, you can explain that in the narrative, and they'll see that really clearly.
Okay.
Yes, so the question was about listing funding sources. If you are applying to Pisgah for supplementary funds, for example, you have other funds secured for your project, let's say the state. I'm just going to use that as an example. So your project costs $500,000. You have $300,000 committed by the state. You're asking Pisgah for the $200,000 balance. You just want to talk about that on the budget narrative section of the attachments. And we can talk about funding as specifically. You can also list it there who the other funders of the project are, but you want to aggregate that information. You don't want to have, you don't need to tell us you have 5 different grants supporting it. You can just say grant support, $300,000. Donor support, $50,000. All right, any other questions before I go to this next slide? Please feel free to jump in for questions. This really helps all of us learn. Yes? If you didn't hear the question was, for the areas that are pre-populated, can you change those? Yes, but if it's a drastic change, please communicate the drastic change in an email to the staff. All right, your statement of need. I love that. You want to elaborate your objectives, describe the community and or agency need or problem your effort is going to address. This is also a great place to insert some of your research. Okay, so these sections, you just want to give a link to any research that you're quoting. If you're quoting the census, make sure you include a link for that, okay? Other funding sources, back to your question about this. So if you are requesting funds from other sources, you want to state that. You want to include any that are already secured. Going back to our $500,000 project model, just let us know what is secured or pending, right? Sometimes it takes 6 to 9 months to hear back, and we're totally aware of that. You just want to communicate what those are. If it's changed since your letter of interest, just let us know about that too, yes. So our question was, if you have that information in your letter of interest already, do you need to recite that research? No, you don't, unless it's a new source or there's some new nuance that you want to add. Great question, thank you. All right, so this right here, oh boy, do not let that be a barrier to you, okay? Take it from me, we're just learning, right? We want to learn about your methods that you're using. Are those methods backed by evidence and research, okay? Let us know what those are. If you know that providing home visiting decreases infant mortality, unfortunately North Carolina ranks 11th worst for infant mortality, you want to let us know what that is so we can check that research too, because we're learning, right? We want to add to our body of knowledge as we build regional efforts. Again, if you have questions about that or you're stumped, please email me, and I can explain this probably 3 different ways, and I'd love to help you with that. So don't let that be a barrier to you. Your staffing for the project, is the staffing model effective for the utilization of resources? Ooh, that's a really great question. I love that you put that on there, Kathy. Again, specific to the project, not the organization. Your collaboration with other agencies, are you partnering with other entities and carrying out the purpose for which the grant is intended? So that's the difference between the collaboration question and the relationships with other organizations. One of my favorite questions, sustainability. Is there a sustainability plan for the organization after grant funding is exhausted? Well, I would bet that we would all love to say yes. And sometimes that is not always the case. Don't judge your sustainability for your project on finances alone. That is a very important consideration. But think about the other aspects of sustainability, right? Has your organization been doing this work for a certain awesome, wonderful amount of time? Talk to us about that. That's why you're the experts, right? Has your leader been in place? Have they gone to certain trainings? Has your staff committed to certain trainings? Do they have special certifications that makes the sustainability of this project viable? So that we understand you might have to seek other grant funds in order for it truly to be sustainable if you don't have program revenue. The foundation understands that. But be thinking more broadly about your sustainability, okay? That's a really important question on a lot of grant applications. And as your grant writing friend, it's not just finances. So there's a drop-down menu, characteristics and age group of the people served, and then there's a drop-down menu indicating the counties in which you provide services. This is really important, all right? We want to make sure, as we get the foundations up and going on Dogwood Health Trust, that we're making investments equitably, right? So that not one county is getting all the resources just because they might have a certain number of nonprofits. So really be judicious in letting us know and the counties in which you provide the services. Okay. All right, this is my favorite question. This is a snapshot from the application. This is, in your words, all these questions, okay? I'm going to go through them, but remember, I'm not telling you what goes here. Kathy's not telling you what goes here. We want to know how you are going to measure the effectiveness of your activities. If it's surveys, if it's they've come for these appointments and you're going to talk about the utilization of your work, if the case manager has transported 50 people in that year. Again, we want you to explain to us what your measurements are. That's so great. That's a great idea, right? Nonprofits have a lot of different ways of measuring their activities. So you tell us how you're going to measure their effectiveness. We want you to describe your criteria for the success of those activities. Again, we're not telling you what we're judging as success. We want you to tell us because your programs are also different. And we also want you to describe the results you expect to have achieved by the end of the funding period, going back to whenever your end date is. When you look back over your body of work that you've accomplished, describe your results. We're getting close to the end. It's great. Making a lot of progress. I really wish I had started this presentation off with the application on your attachments first. As your grant writing friend, please do not leave your attachments to the end. Don't tackle these 2 days before it's due. I'm telling you, I've lost some serious grants by doing that, and I wasn't able to get the attachments that I needed. So learn from my mistakes, okay? These aren't hard, but they are going to take you some time, particularly with what they're asking for your information about the board, okay? So for your financial statements, this is exactly how it looks on the application. Audited financial statements for your last fiscal year or 99-day. We know that sometimes there's a delay with taxes, so whichever you have that you can submit would be helpful. If you don't have either document available, we really prefer those two. We will include your most recent financial statement that does need to be initialed by a leader in your organization, either your board chair or your executive director, but hopefully you can provide a 990 or a 990 EZ or an audit. Your operating budget, the current year's operating budget will include both projected expenses and revenues. You want to categorize your expenses under these headings, okay? Program, general administrative, and fundraising. It isn't gotcha. However your organization and your financial person accounts for your different categories, we'll accept that. Again, we just want to see these more broad headings. Spend a little time on your program budget with a narrative. This can be an Excel that's turned into a PDF. You just want to say specifically what you're doing with the funds for the investment. Give us if you need to hire an after-school care manager that's a licensed clinical social worker. That's fine. Just let us know, okay, in the narrative section. A list of your funding organizations, foundation, corporations, or government agencies that funded the organization in the last fiscal year. And I'm sorry, this was cut off. Let me see if I can fix this. My slide. Well, I'm sorry, I cannot. Again, so you'll be able to see on the application all of the headings for this, but again, it just needs to be aggregated information. So if you had 5 donors give you $1,000 or more each, you can say donors gave this amount, all right? We definitely do not want names. We don't want any of your private investment information, certainly. You just want to aggregate the information. All right, your tax status verification of your or the fiscal agent's tax exempt status under the 501c3 or 509a of the IRS code. If you are using a fiscal agent, please include a notarized letter of authorization saying that you can serve as the fiscal agent. Yes, so on this section, it gets on the budget, on your program budget or your operating budget, it's going to be the current year operating budget for the organization, just general categories, and on your program budget, those two things should marry each other. They should reflect each other. All right, so for your board of directors list, you want the current board of director list showing the executive committee, their employment affiliations, including if they're retired, you say retired former military commander. And the board service term, again, we want to be educated about your organization. Your board of directors are your fiscal agents, so we just want to make sure that we know who they are. They're also interested in looking at your current bylaws of your organization. Again, the Secretary of State, I understand sometimes office shifts, we don't know where those foundation documents are. You can find them there. All right, letters of agreement, if applicable. If the project for which funding is sought is a collaboration, you want to include letters of agreement specific to the project from each collaborating agency. You want to combine those into one file. If you don't know how to combine PDF files or you need some help, please email me. Okay, that's a technical question that I can help you with. Your annual report, this is optional. Yes?
Letters of agreement, would that be including like our contracts?
So this is for the project. If you're collaborating with other agencies that are required for the project to be successful, that's who submits the letter of agreement on their letterhead to you. Your annual report, that's optional. If you have a great annual report you want to share, if you have a one-sheeter about the clients that you served or a comparative change, anything like that. Again, this is just for the foundation to get to know your organization better. And then this is also optional if you have an org chart that you're interested in sharing. Again, it just is going to help them be educated about your organization. Here's your staff contacts. Any other questions? We got them. Yes.
Just confirm, the funding is used either operation or capital. So if someone was going to say build a nursery, you could build a building as well as run it.
Yes, you could. So his question was about the specific types of projects that can be requested, either operating support, capital, or programmatic. So again, if your project fits into those broad categories and can achieve measures that the foundation is interested in funding, ask for the organization's highest need. So the example he gave, could we request funds to build a nursery and then operational funds to staff it? Yes, you could. Okay, so that would be a really broad project, but that would definitely fit within their RFP heading. Any other questions? The funding cycles over time will change depending on what the region is trying to accomplish. And also the legacy foundations are going to be working together in some consortium capacities for regional projects. So somebody might be funding really heavily in broadband, for example. Another one of the legacy foundations might be funding more heavily in substance use prevention. So I think that will take shape over time. So this is the program budget it should say project budget. Okay, that's a great question. Thank you for asking. She's asking for specificity about the budget. It's an excellent question. So your financial statement, that's the last year's fiscal accounting for the organization. Then the current year's operating budget, including projected expenses and revenues for the organization. And then the program budget, that's your project budget specifically related to what you're requesting funds for. If you have other funds committed, that's fine. If you don't, that's fine too.
And the funding organizations is back to the organization.
Yes, I'm sorry that got cut off, but that's how it will look on the application. And again, that's to help us learn about your organization. If it's changed, if you had something that was pending, and then by the time you get the funds, you were awarded the funds, and it needs to shift, we totally understand that. Just be in communication with us. Hi.
Okay, this may be specific to our case, I don't know, but.
It will probably help someone.
So we put for our organization, for Blue Ridge Community College, the foundation.
Right.
Okay, so however, some of the things we're doing are actually for Blue Ridge Community College, but the foundation supports us.
Right. So the foundation will be the fiscal agent in this case. So you would want to report everything of the fiscal agent, right?
Okay.
So you're talking about, you're probably wondering, well, what
Yeah,
budget do I?
yes.
Yeah. So
Yes.
just go back to, if you get confused,
Everything for the
who's
foundation.
who's responsible for the accounting of the funds? Great question. Usually right in here, you can also have, and they're optional, letters of support. So if you work with community leaders that say, oh, this is the best organization that does everything that we need, you want them to write a letter on their letterhead, and you would put it in the letters of support category, but those are optional and they're not required. If you're using client letters of support, please, I know you all do this, but just make absolutely sure you have their permission to use their information if they're willing to share a letter of support. I'm sure that you all do. We just want to be really careful we're not marketing someone's misfortune without their permission. Sorry about the discrepancy. Anything else? Any other questions? All right, well, yes.
On the letters of agreement or the collaborations, are those optional or required?
Those are required. If you have, if your project requires a collaborative partner and money is going to be exchanged as part of the collaboration, they're required. Saying that, yes, we agree that we're going to formally help you with this project. Any other questions? Yes. There was a part on the LOI that had additional comments, and so what they had done is they'd used that as a bibliography for their links, but you want to keep that germane to the section that it's in for the application, just because the online review for the reviewers is different. So they'll look at the section, and each application will have a different weighted score based on different sections, so you want to keep the research with the section that it pertains to in the application.
That's very helpful.
Okay, good.
Are the deadlines still the same?
Yes.
Okay.
Deadline's still the same. I don't have any information to share about that process other than I can tell you from the back end, it's a formal process that it's done anonymously. Scores are aggregated so that there's an average. So they want all the legacy foundations have agreed to make the application process as equitable and fair as possible. So that way you don't have one dominant, I mean, you all work with boards, right? You get opinionated people like me on a board. You don't necessarily want the most dominant voice determining all of the success or failure of the grant application. So that's why those scores are averaged. So, if you also, by the same token, have someone who's very negative on certain types of organizations, they don't skew it either way. It's a formal process. It's online. It's anonymous. And then they will, all the grant review team will review the applications with the aggregated scores and make the funding decisions from there. So again, I can't reiterate enough. I know that one thing that is very particular with this application is make sure you're referencing the request for proposal funding focus areas, right? So you want at every stage to be talking about how you're going to make that investment effective. All right, well, thank you, everyone. It was great. Yeah.